Good afternoon, everybody. Hopefully you can all hear us here at the state office. Donna and I are presenting this webinar to you today on SHIBA counseling resources. A couple housekeeping things before we get started. Up at the top right corner where it says files is a handout version of today's PowerPoint. You would just put your mouse over the top of it, click on it, and then download file, and that would give you the opportunity to save it on your computer. In the chat box underneath that, please make sure that you put your name and the county that you are representing so that you can receive recertification credit for attending today's webinar. And then below that is a question and answer outlet where you can put in a question, and as we see them come in, we will address your question with the group. At the end, we will open up the line to questions if you'd like to speak your question rather than type them. And with that being said, I think that we can go ahead and get started. So welcome, Donna Delacat.
Hi, welcome everybody. I want to start off by saying if you have recently attended the new volunteer training, this was partly included in that training for new counselors. We do have a fair number of new counselors, and so we thought it would be important to repeat this information and then also offer a demonstration of some of the website particulars so that if you have any questions, you can see actually how it works instead of just looking at the slide presentation. So we'll get started. I thought maybe that these are the key websites that would be helpful in the upcoming open enrollment period, but any time is probably a good time to kind of hot nose around these areas and see what is available. You may not completely understand everything. You might just see the bullets or the headlines, but when I'm looking at things, I'm always kind of in the back of my mind saying, okay, I got to bookmark that in my head for future reference, and so that way if I need to go find it, I at least will have some idea that it's out there to start with, and if it's out there, then usually I can find it in one of the key websites. So we're going to take a quick tour. We have been working on the SHIBA.oregon.gov website to put things on there that are relevant to what you need. Some counties have specific websites, like Clackamas County has their Weebly website with all of their great resources available to their clients. So we're trying to mirror that a little bit more so that everything is available at one-stop shop for counselors if they need to access some of that important information.
I'm opening both up on the share my screen, that way we can switch back and forth.
Oh, okay.
This is okay. I apologize for this. We're going to be sharing our screen, and so this isn't something that we... Perfect.
Okay.
Here. Okay. So would you like me to go to SHIBA.oregon.gov?
Well, we're going to just go to the next slide. I just wanted to show you what, instead of go into presentation mode, so it has the actual, there we go. So if we go forward one slide, I just wanted to make sure everybody was aware that where are the OregonSHIBA.org or SHIBA.oregon.org, SHIBA.oregon.gov, is located in all of the tools that are available on our website should you need something that is available there. Next slide will show you where to click. Well, it didn't quite show it. Adobe Connect is, if you were to click on that first menu, if you can go back one, Miranda, it's hidden on ours.
They can see it.
They can see it. Okay, so in the circle there is an arrow pointing to the Medicare Counseling Tools section. Yes, right there. That's what I was getting at because I couldn't see it. Okay, so Medicare Counseling Tools, and then if you were to click on that and go to the Counseling Tools website, there we go. On the left-hand side, there is a menu, and you would actually have to click on the Tools and Outreach sample on the left side menu to get to this page. And I just wanted to make sure everybody realized how many outreach samples and tools and handouts and reference material items are on this particular page. At the very bottom is some of the more dynamic stuff. So the top part is stuff that is more or less evergreen or can be branded specifically to your needs. There might be documents in there from other areas that can be modified. But at the very bottom under additional tools, we have the link for the group site. If you're not already on group site, we'll take a look at that and see how, if you have questions and you want to connect with your fellow counselors, there are some good discussion groups on group site. We oftentimes will interface with licensed insurance agents, so that second bullet there, we are actively recruiting agents to take the additional training on Medicare and become qualified to be on the agent locator tool. So we have in some areas very few, if any, agents that have pursued getting on that agent locator tool, and one of the ways that we can help the consumers is to get more agents that have taken our training. We had an agent summit here yesterday, and we are actively building those relationships with agents in the community so that we are all serving the same population with the same level of expertise in the Medicare program. Dental plans, that says 2018. I don't think we may have updated it for 2019. I will make sure that that gets updated if it's available. The 2019 fact sheet is the Medicare fact sheet is the parameters for both the low-income subsidy for prescription drug income and resource eligibility criteria and the Medicare Savings Program eligibility criteria. We're in the process, or I'm in the process of getting some of that information ready for 2020. As soon as the 2020 information is available, the Medicare Savings parameters are not available until February, so those don't go into effect until March 1, so we still have quite a ways for that. We do have some 2020 Part D information, however. Certainly the STARS frequently asked questions. I know we're having some challenges. Everybody's having some challenges with STARS. And then, of course, the ever popular SEP chart at the very bottom there, the special enrollment period chart. We use that quite a bit here in our office. If you think somebody might be eligible for a special enrollment action, then please take a look at that chart. That is a really handy reference. There's only 2 items that are not listed on that chart. One is the living outside the service area of a Part D plan or a Medicare Advantage plan. If you are living outside the United States or if you are incarcerated, you are not living in a Medicare Advantage or a prescription drug service area. And so therefore, when you come back, I think it might be on there. I think I have to look again. It does give you an opportunity within the first 60 days of returning to the United States or returning to society to enroll in a Part D or a Medicare Advantage plan, of course, depending upon your Medicare A and B enrollment. Okay, let's go to the next one. We're going to take a look at group site, just a quick review of that. This is under the Communicate Discussions section. So you can see I've circled the Communicate. This is not the front page. This is the menu at the top. And there is a whole bunch of different discussion forums. Certainly if you have questions you want to throw out to the general counselor population. But we also have updates from our office and updates from the CMS office. And so this is great if you want to see the latest and greatest updates that we have received. We are typically posting it here and sending it to the coordinators that we hope are being passed along to you. Sometimes this is very important information and we want to get it out to the network as quickly as possible, so we post it in both places, both to the coordinators and to the group site. So if you're on group site, you'll have that at the ready. Medicare.gov, certainly one of the things that is our regularly used tool. I just wanted to point out a couple of other areas because most people go to the drug plans or health plans. If we move forward one, I'm going to highlight sign up and change plans. We can actually see, and I have a slide on this, someone's enrollment. If you go to that menu, forms and help resources. I find this to be a pretty helpful area on the Medicare.gov website. We'll see a screenshot of what that looks like. And then, of course, the last one, which is the Find Health and Drug Plans, which we use on a regular basis. You may or may not have heard that the Medicare Plan Finder tool is going to be changing, and we're going to preview that at the fall update training. If we get additional information before then, we'll certainly send it out. Right now, we're understanding that the demo or the new changes to the program are not going to be live until Labor Day. There was a webinar that demoed the upcoming changes last week. I was unable to attend due to training. We're waiting to see when that recorded version and the PowerPoints are available, so we will certainly send that out to the network as well so that you can take a look at it in advance of the actual rollout. So this is under that first circled left side where it says sign up and change plans. And what I wanted to highlight was at the very bottom left-hand side, there's this check your enrollment. That's a pretty handy little tool, and I'm hoping that it's going to remain so that if we don't have somebody's current information and they don't have their cards with them, but you want to see what they have, you could check their enrollment. So it requires putting in their Medicare information, obviously, but it will give you some data back to let you know exactly what that person is enrolled in, if they have a plan, or if they have a subsidy, I believe. That's a good one. This is on the right-hand side under the Forms button on that main menu. And this one I use most often for the actual Medicare forms. If you go to the Medicare forms, then it gives you a whole bunch of different forms to choose from. Most commonly, what I find in my counseling experience is that I have somebody who's getting ready to retire and they've been working past age 65. So they need two forms here, and it's right underneath the enrollment forms. So the 40B, the 40B is the application to add B, and the L564 is the employer completed form that proves that they had active work group health coverage in order to add Part B in a special enrollment period. Without that L564 form, Social Security is going to say, well, we're not quite sure yet. You have to prove that you have a special enrollment period. So oftentimes I will have copies of those, or at least show people where to get them, so that they can print them and submit them with their enrollment form for Part B, or take them to their employer to get them filled out. But there's lots of other good forms on here too. There's the paper claim form. Seems to me we had 2 requests for paper claim forms just this week. And then we also have designating someone to represent that person in an appeal. That's the appointment of representative. So lots of good information on here in terms of forms and helping clients understand how to achieve what their goals are. The next website that I hope you're familiar with is the shiptacenter.org. And the front page doesn't really show a whole lot because this is public facing. You actually have to log into the as a SHIP counselor in order for that website to provide you with all the additional information that is available to the SHIPs and their counselors. So once you log in, now you have this additional menu of options here, and the most common one is going to be the resource library. If you go to the resource library, there are all kinds of great information. Certainly on the front page are the features. Those are the most relevant, timely announcements and or SHIP counselor related information. And then on the right-hand side, you've got a bunch of quick links if you want to go straight to something that is offered there. But you can search through the resource library for webinars or trainings or handouts, Medicare minutes on topics. The most recent Medicare topic, that says August, is on Medigap's, but the one that I used pretty much a lot this last couple of months was the Part B and Part D prescription drug coverage. So they gave a very nice handout on the parameters of what constitutes a Part B covered drug versus how it's covered under Part D. And sometimes it can be very subjective depending upon the circumstances of the individual beneficiary. One of the other things during open enrollment that we are going to be using quite frequently are resources to help people afford their medications. I didn't include, and I should have included, the Part D, as in drug parameters for 2020. They were announced last month. The TROOP, the true out-of-pocket, is increasing from $5,100 to $6,350. And just as a quick review, the TROOP is what is calculated through stages 1, 2, and 3 in order to get into stage 4 catastrophic coverage, where the cost share is 5%. So in 2019, beneficiaries are paying $5,100 out of their pocket and or including a 70% discount on brand names before they get to the stage 4 catastrophic coverage. Next year, they're going to have to spend $1,250 more to get to stage 4. I anticipate we are going to have a lot of calls from folks who are unable to afford their medications in stage 3, because even 25% cost share in stage 3 can be pretty financially difficult when you have medications that are in excess of even $200-300. Advair is $400, so that's going to be a $100 copay in stage 3 for the majority of the year. So I'm just kind of holding my breath and waiting until the the proverbial fan gets going and everybody realizes, wow, I'm never going to get out of stage 3 coverage gap, and I'm going to have this copay going forward. So that's why I wanted to review some of our patient assistance, copay assistance discounts available to our clientele. So the first website we're going to look at is Needy Meds. And Needy Meds is pretty much the go-to for finding a consolidated list of all of the patient assistance and or copay assistance programs. There might even be some chronic disease foundations that are listed under a different way, but primarily we're going to be looking for the individual medications. So you would go to the drug search area there on the left-hand side, put in the name of the medication, and if you spell it correctly, it will pop up a list that you can choose from. Hit that drug search button, and then you get to this page where it says, okay, did you mean these types of drugs? And it gives you a whole bunch of icons that indicates how that drug might have some assistance. So we've got all the icons up there, and then we look at the list down below, and yes, we're looking for Enbrel, and that we'll click on that Enbrel, and that pops up another not a window, but opens up the icons below it, and we're going to look at those little capsules there, because that indicates up in the legend at the top that those are patient assistance programs. So once we click on that, back up a little bit, yeah, once we click on that, the window will open all of the companies or foundations that might offer some help with purchases of that particular medication. They are usually in most beneficial to least beneficial order. So the top program is going, if it's available to Medicare Part D beneficiaries, will be the one that will give them the best benefit of if there are more than one program. And looking at the parameters on that list, it'll usually say available to Medicare Part D, question mark, and on the right-hand side it might say yes, it varies on a case-by-case basis, or no. Even if it says on a case-by-case basis or no, it might have something similar on another avenue at that same company that would be available. So I wouldn't be deterred in referring clients to talk to those companies that may not say right up front that they will help Part D folks, because there are some folks that just cannot afford their medications, even if their patient assistant isn't available. We can still maybe go to bat for them. The other thing that it might tell you too is whether or not the income qualifications are at a much higher level than what would be offered under some federal subsidy program. I know I've seen up to 500% of the federal poverty level, which for an individual could be in excess of $4,000 or $5,000 a month. So lots of good opportunities there for folks who meet eligibility assistance with their very expensive medications. Good question. Okay. Does Needy Meds show a different or broader list of patient assistance programs that we get through Medicare Plan Finder, or will it be the same list? You know, Corey, I tell you the truth, I haven't really looked at the Medicare Plan Finder patient assistance, because I've always gone to Needy Meds. So I don't have an answer to that question. Maybe some of the other counselors who use both would be able to chime in and let us know. I will make it a point to remind myself to use that patient assistance link on Medicare Plan Finder, and with the updates to the Plan Finder tool, that may be a more relevant avenue to use, since it's going to be right there and available to us when we're doing counseling. Okay. We did that, and that. Okay. The next website I think that might be very helpful to folks is OPDP. This is a discount program. It is not insurance. But we oftentimes will see folks that either don't have a drug plan and they can't get into one right away, and maybe they have some medication needs, or they have some generics on their list that their plan might charge them a lot more than what they could get using OPDP discount. In some cases, I have a client who has more medications on her list than will fit on the drug list. That's pretty atypical. I think the drug list tops out at 25 medications, and she has about 30. So I take all her generic medications off the list, because most of them are covered by most plans, and I focus on the insurance side for just the brand names. And then I calculate what her best cost share would be if she were using her insurance plan versus using OPDP. In her case, we generally look for a plan that has no co-pays in stage 4. And there are plans out there that might actually serve beneficiaries who have subsidy. In this case, this person has subsidy, but she has mostly brand names due to a highly allergic response to most fillers in generics. So her brand name list is pretty long, and when we look at plans, we're definitely looking at plans that she's not going to have that $8.40 a month copay for her brand names. And even if she has to pay a $50 a month prescription drug premium to get to that stage 4, because she'll be in stage 4 within 1 or 2 months every year, $50 is cheaper to have 0 copays for her brand name drugs in stage 4 than it is to pay $8.40 for every single medication. So work those conditions to your client's advantage. We do have a Part D Plan Finder webinar available that is illustrating that. And Hetty is saying that the Plan Finder now offers up to 40. Okay, well, I guess I need to go back and add some for my gal who has 30, and
the new Plan Finder.
The new Plan Finder is going to have 40. Yeah, very good. So OPDP is really, really easy. All it takes is name, address, telephone number, and email address, and date of birth to get somebody enrolled. Lots of good information on opdp.org. Click one forward. There, right on the home page, there is a Enroll Here button. They do have multiple languages, so if you need to print off a different language and give that to somebody, or they actually have a online Spanish language enrollment form as well. And you can look up drug costs. So comparing a drug cost using the discount program versus using an insurance program is pretty easy as well. You do not have to be a member to look up drug costs. All you have to do, there's a couple of different ways you can click on it. This is under the members tools, but there's also a look up drug costs on the side, and it doesn't have anything to do with actually putting in a member information. So definitely let your folks know about OPDP. The more people who enroll in OPDP, the better bulk discount pricing we are able to negotiate. This does compete directly with all the store discount programs, GoodRx, coupons, RX Saver coupons, that sort of stuff. But just getting folks enrolled is the biggest impact. So even if people have insurance and they are happy with their insurance, if they're willing to get enrolled, we would promote getting them enrolled in this program. All right. I wanted to call attention to when you need to enroll somebody or apply for the low-income subsidy. If you go to benefitscheckup.org, this is the screen that you will see. It's pretty busy, and it's not the front page of the Oregon SHIBA page. So I just wanted to show you, if you go to benefitscheckup.org, that's what it looks like. Click forward. If you go to benefitscheckup.org/Oregon, this is what you see. Click forward. Oh. There we go. It is branded with our SHIBA tagline, and it's got a direct right in the very middle of the front, next one, the Medicare Extra Help application. So much simpler than going through the benefitscheckup.org without having the branded /Oregon site. Again, we have a whole webinar just on filling out the application. If you've never done one and you want to get a little more information before you do it with a client, it walks through every single question on that application that can familiarize yourself with that process, so that when you get there with a client, you don't feel like you're doing it lost for the first time. Definitely take a look at that. All right, that was pretty fast. I would like to do a couple of demos before we open up all the phone lines. Let's go to the internet. We're going to go to the agent locator tool. We have a number of people who come to us, and we give them all the best information about Medicare, certainly the new to Medicare folks, or the folks that are coming into the state, and they have all their options on the table. And maybe they want to pick up a Medigap policy, or maybe they would like to work with a local agent that they can, see on a periodic basis. So on our agent locator tool, which is at healthcare.oregon.gov, we're going to, sorry about that.
It's our little interlude.
Yeah. So we are find local help right at the top there. And one of the things I mentioned already is we're trying to get more agents on that agent locator tool. So if you are in a particular area, you can put in your zip code, click on Medicare agents, and then search for that help. And it'll bring up both a map and a listing of those agents in a certain mileage area that have, one, taken additional Medicare training and passed with 80% or better. 2, they have no substantiated complaints against them. And 3, they have been in business for in excess of 3 to 5 years. Those agents are I don't want to say contract. I don't want to say storefront. What's the word I'm looking for? Locator agents.
They are approved by the state of Oregon.
Approved, yeah. Vetted.
Vetted.
That's the word I was looking. To be on the locator tool.
Yes.
Yeah.
I do want to point out that next to the agent's name are a couple letters. And if you look back at the top, there are letters next to your selections that you're able to do. So the first agent here, David, has an A and an I, which means that he does Medicare and also individual health insurance policies. And that way you just, maybe you meet with someone who the one spouse is Medicare age and the other spouse is not. That agent would be able to help with both of them. So when you select one of these options to search for, all you're doing is filtering out a list of all of the agents that we have input in the state for whatever zip code and criteria you've put in, and it just filters out from our massive database of agents what meets your search criteria.
You want to tell them what the other ones are?
Up here also is a good
good.
explanation, but there is not an explanation of what this star is. The star are partner agents, also called, well, I guess it's a sun. Anyway, this little yellow thing indicates that an agent is a partner agent. This really pertains only to the marketplace and individual plans, but these agents have gone through a competitive grant process with the State of Oregon Health Insurance Marketplace, and due to the competitive process, they have been granted grant funds to promote the marketplace and to offer vetted service by the State of Oregon, and to make sure that people are getting the information that they need. They go above and beyond for the marketplace. So just so you know what that is and what's going on with that. Also, I will point out that if someone goes to this tool and is looking for Medicare counselors, and they search, that's where you guys show up. Sorry, the computer's being slow here. But here's our local Marion County, Polk County, Lynn County. Here are our SHIBA offices. And they have sons next to them. That is because they are receiving SHIBA grants. Any agent or entity that's receiving grant money has the sun next to it. Okay, Donna.
Okay. The next thing I wanted to point out, if you haven't seen us do this at trainings prior, we are going to demonstrate how you might be able to find information easily by using Google as a search tool. So we're going to go to Google, and today I was actually looking for something specific that I knew was going to be on the CMS website, and I put in 2020 Part D.
It never fails every time I demo this.
Part D parameters.
It never fails. It's like I get nervous.
Yeah. Okay. So I wanted to see what the Part D benefit structure was going to be.
Donna, what is this craziness that I put at the beginning of the search?
So this is using Google as your search engine, and instead of just searching on 2020 Part D parameters, because that might give me a whole bunch of different websites, Q1.com and Medicare Rights Organization and maybe some agent information, whoever's putting that information out there. I wanted the official information. So I said, Google, I want results only from cms.gov. So that's why Miranda prefaced the search terms with search this site, search site:/cms.gov. But you could put search site:/medicare.gov or search site:/ssa.gov, whatever.
Or MedicareInteractive.org.
Yes, whatever website that you are thinking that you might find something that is what you're looking for, you could designate to only get results from that particular site. I do this when I go looking for plan evidence of coverage documents. In October, when the new plans come out, we typically will create a list of hot links to those evidence of coverage documents. So I'll go to Regents.com and I'll say cite Regents.com 2020 Medicare Advantage Classic EOC or whatever it is, whatever the search terms are. I might have to play around with it for a little bit. But it gives me all the results specifically from the website that I'm saying, Google, I want to search this particular website.
It is very helpful.
It's a lot cleaner way to find the information you're looking for. Okay, so let's hit return. And there it is at the very top, announcement of calendar year 2020 Medicare Part D parameters. So let's go there. And we're going to pull up this document. And this is pretty long. It's a lot of pages. I want to go to page 64. Can you go straight to page 64? There you go. Click on 1. There you go, 64. There you go. So this is the attachment that I found today. And it is a comparison of what 2019 Part D looked like with what 2020 Part D is going to look like. So I just wanted to point out to you how you can find this kind of information easily. I do this a lot with manuals. When I'm trying to prove a case for a client, I might go to the manual that I'm looking for and put in some search terms specifically for that client situation. In this case, I think look up benchmark. I was also looking for the benchmark of that particular, is it 2 words? Huh? Yeah, it's one word, yeah. See if we can find benchmark anywhere. Okay, so we've got quite a few references, 49 references to benchmark. I might just click through all of those until I get to the one where it says, what's the benchmark for plans in 2020? Keep going. I think I found it was $37 and some cents. Okay, keep going. Benchmarks. Keep going, yep. You'll get there until you see $37. I'm just looking for a dollar amount at this point. This is how I search through documents really fast and find the information I'm looking for. Keep going. Probably in that same attach or I want to say attachment, but it's the getting close, 48, 49, no. Okay. So it's in there somewhere. If you scroll down a little bit, maybe I went to a different website to find that. The benchmark was like $37.54. So actually it had to pull up because it's state specific.
Oh.
It is the benchmarks are state specific. So I did have to go to a different website. So let's do another search. Open up a new tab on Google.
Just so you know how I got to this to be able to search is I hit Control F.
Yeah.
So you hold down Control and then you hit F and it pops up.
Okay.
How do care talk about
Google. Yeah.
I know.
Okay.
Have it.
So site cms.gov 2020 low income subsidy benchmark. Okay, so there you go. You got to pull up that rate book, and then you scroll to the bottom there, and it's got C&D regional rates and benchmarks right there. And this is just a 2-pager. Go to page 2. That's MA plans. Here's the low-income subsidy benchmarks. For Oregon is $32.57. So when I said to this morning, that's what I was gathering. I was gathering all that information for the new Medicare fact sheet. I was doing a lot of hunting for all that information. So
why do you suppose Idaho and Wisconsin is so much more?
Because their insurance plans are much higher priced.
Oh.
In fact, the average price of the Part D plan nationally went up to like $47
Wow.
next
that
year.
means Texas has cheap plans?
Yeah, must be. Anyway, so that's how you find stuff. If you need help finding anything, Miranda and I are pretty good at doing searches.
yeah.
And usually we will include a link to the address on the internet that we found the information, plus maybe a little summary at the bottom of where in that document, if it's a long document, that we pulled that information. So just wanted to give you some of those tips and tricks that we use when we're answering questions from the Counseling Network.
So that is the 2020 benchmark.
Uh-huh.
I'm writing it down because you know I won't remember it.
Okay. All right. So with that, I think I'm going to open up the phone lines so that everybody can chat about what their best practices are, and then we will definitely...
we have a couple questions here.
Okay. Chris is saying, recently we were processing a client in Washington County working part-time. She had... Oh,
I gotta make this bigger.
yeah, make it bigger so I can see it. She had been getting subsidies for disabilities. I'm not certain what a subsidy for a disability would be. And Chris said she forgot to mention, too, something else. Is there an SEP for that kind of client? I forgot to mention she was 67. Okay, so Chris, in a case where somebody is working part-time and they are meeting the Social Security disability
employed persons with disabilities
parameters, I would encourage them to go apply for the Employed Persons with Disabilities program. That was our July monthly Enrichment webinar, and we had a subject matter expert from the EPD program that said they only have 1,400 people enrolled in the program statewide, and if more people knew about it, they would definitely benefit from it. Oh, she was just stopping work. Well, if she was just stopping work, did she have drug coverage while she was working? If she didn't have drug coverage, why didn't she have drug coverage? So yes, we would certainly want to explore that. If she's stopping working, she does have a special enrollment period if she's losing other coverage. And she was on that program. So she would have a special enrollment period because she would be losing that coverage, absolutely. And she should not be subject to penalty because that program had other drug coverage. Okay.
All right. I gave everyone microphone rights. If you called in, I also unmuted your phone. So you have the option of typing a question, or if you'd like to go ahead and ask a question, we are happy to take those.
Or any of your sage wisdom in dealing with all of your clients that you've had successes with. Agreed, Chris. We should probably take a look at making sure that I think when the item on the SAP list says you are losing other coverage, and that would be considered losing other coverage if you're losing Oregon Health Plan through the Employed Persons with Disabilities program. Mm-hmm. So they make it very general, but it does apply to that specific program as well as any other Medicaid program. Anybody want to raise their hand or shout out?
I think this is the rowdiest bunch we've ever had on a webinar.
I just can't imagine. No
Okay,
questions.
all right. Well, thank you everybody for taking the time to spend with us today for us to deliver this information to you. If you have any of your fellow SHIBA counseling friends who you think would benefit from this webinar, please do not hesitate to share. We'll get it up on the website hopefully this afternoon or tomorrow.
And don't forget to tell your coordinators that
Yes.
you attended.
Yes.
We'll have record of it if you chatted your name in, but sometimes the coordinators like to keep that training record as well.
Yes. All right. Well, with that, we will adjourn and say adieu.
And I would like to just point out to everybody that we have a new bride, Mrs. Amstutz, got married over the weekend. Miranda Maffei is no longer a Maffei, she's an Amstutz.
I am
So if you
Miranda
see
Amstutz.
that odd last name coming across, you'll know why.
I know, I just had to go change my identity.
All right, everybody, have a wonderful afternoon, and certainly send us your ideas, questions, sharing, so that we can answer any confused information that we provided.
I will have the same email for now, and when it does get changed, it will continue routing my miranda.s.mathey@oregon.gov to my new name. So you don't have to worry about getting a hold of me.
Hit return. There you go.
All right, everybody. Have a wonderful afternoon.
Thank you all.